So you do a lot of IV sedation. Who's a candidate for this procedure?
So IV sedation is done very routinely in our office, and it's done very, very safely. We place all the monitors that you pretty much would have in a hospital setting on the patient beforehand: blood pressure, oxygenation level, CO2 monitor. We give them oxygen. So everything that you need to properly monitor the patient. And the way it works is, before the IV sedation, you're not allowed to eat or drink anything for 6 hours. And after the procedure, you have to have someone that can drive you home.
Okay.
Those are the two requirements for IV sedation. And then we do a proper, medical history exam on the patient to make sure that they're healthy enough to have the IV sedation done in an office setting. And most people are.
Now, you're a medical doctor and an oral surgeon. Is this true that certain people that are highly anxious, you even give them a pill the night before?
Yeah, absolutely.
Because they can't even sleep.
Yeah, we have lots of
right?
patients who've come in not having done this, and they're like, I was awake the whole night because I was just thinking and anticipating about this procedure. So for those patients, what we do is we give them a little pill. They take it at night so they can get a good night's rest. They take another one about an hour before the procedure so that they're calm when they actually come into the office. And so we quickly start a little IV in their arm. They hardly even feel it. Give them a little bit of medication, and they have a light sedation where they're not really aware of what's going on. We give them local anesthesia, we give them the injections, which they don't feel, and then they're numb and they don't feel anything throughout the whole procedure. And they wake up and they're a little groggy, but they'll walk out to the car themselves, most likely, and they'll be a little sleepy that day, but within 24 hours, all the effects have kind of gone away.